This is the pre-appointment infection control process evaluation. During this, we are going to demonstrate everything that we would like you to. However, there will be parts where we give you helpful hints. You are not required to verbalize those. Those are just to help you through this process. Okay?
Okay, so first she's going to check the water bottle fluid level and refill it if necessary. She will add the blue tab each time before filling, if she needs to. And then she will turn on the water switch. So you just flip those up right there. Awesome. And then she will remove the rheostat and ultrasonic foot pedal from the top of the patient chair and place them on the ground. And then she will lower the patient chair and then she will turn on the master switch. It's just right back here. Then she will put on mask and glasses. And then she will wash her hands using the aseptic technique.
We will do this 3 times for 30 seconds each. For this video, we will just be doing one 30-second hand wash for you to see.
And then after she's done rinsing her hands, she will take 2 paper towels. She will dampen one and place it on the bracket tray right here. And then she will use the other one to dry her hands thoroughly. And then she will use that paper towel to turn off the faucet. And immediately put on gloves. Then she will use the damp paper towel to dust the light shield, the lowered patient chair, and then the operator chair in a top to bottom method. That's the patient chair and then the operator chair. Helpful hint, she is making sure not to touch the clean parts of the chair with her other glove. And then she will dispose of that. And then she will flush the air water syringe line for 2 minutes at the start of clinic and 20 to 30 seconds in between patients. So another helpful hint, we always use the air water syringe that's on the bracket tray over here, not this one on the accessory arm. And she will hold it as close as she can to the suction without actually touching the suction.
With my air water syringe.
So you are supposed to do that for 2 minutes and then 20 to 30 seconds between patients. For this video, that will suffice. Then she will obtain, turning her head to avoid splashing her eyes, 1 disinfectant wipe for each hand. And she will take caution not to touch any clean surface with gloved hands, and she will need more than 2 wipes, as surfaces must stay wet for 5 minutes. She will carefully disinfect all surfaces, including the lid of the wipe container, every time she takes out the wipes. Then she will start with the light handle and arms. Not skipping any sections. Then she will move on to the bracket tray arm. And then the bracket tray. Then she will move on to the view box.
Never touching the face of the view box.
And then she will do the handpiece tubing holders and tubing. So another helpful hint right here, see how she holds this part of the air water syringe with her wipe instead of the glove, because that part's clean, so she can't touch it with her glove. And then she also makes sure to wipe down the holder really good before she puts the clean tubing back in the holder. And she goes all the way to the bottom of the tubing. Okay, and then she will do the accessory arm tubing and holder. So the whole arm.
A helpful hint is to make sure that you turn the switch on and off so you get both sides. And that will be something you'll want to do for your pre and your post-infection control. Well, I dropped that, so I will re-wipe it and reset it up. Happens to the best of us. Because I dropped that wipe, I am going to get 2 new ones. A helpful hint is when you are doing this, we do have it written in your PE to get 2 new wipes at certain areas. However, the rule is that anytime your wipes get dry is when you should replace them. So if that's way before the times where we've kind of designated for new wipes, go ahead and get a whole new set of wipes. Anytime it's dry, because it should last for the 5 minutes as your PE states. Okay?
And then she will wipe down the ultrasonic, including the handle and the tubing.
Oh my goodness.
Okay, now she will wipe down the ultrasonic, including the handles and tubing. And then she will obtain 2 new wipes, 1 in each hand, and will carefully disinfect the rolling cart. And here's another helpful hint. We'll move everything to one side and then wipe down one side of the cart so it's clean. And then as you wipe down the things on your cart, they are clean, so you want to put them on the clean side. So she's wiping down the rolling cart, the bib clip, the pins, the sheet protector, which is utilized for the barrier technique. Good. And then she will wipe down the patient armrests. And then the drawer handles. And then the countertops. And then that is the red bin that should be wiped down inside and out. Then she will obtain 2 new wipes, 1 in each hand. And carefully disinfect her shoes. The base of the patient chair. And then the base of the operator chair. And the operator chair adjustment levers, and then she will do around the sink and inside of the sink. And then she will remove her gloves and use hand sanitizer or wash her hands immediately. And then she will begin to place barriers on all the surfaces which may be contacted during clinic procedures, including the patient chair headrest, and another helpful hint is when she's shaking out this bag, she's going to make sure it doesn't touch the ground before she puts it on. And then she made sure the chair back and adjustment controls were covered, and then she will be doing the operator chair back. And then the accessory arm.
So helpful hint, you will be using the saliva ejector and the HVE, so leave those out.
And then the bracket tray.
I'm going to lift my bracket tray up, that way I can get my bag underneath it without my bag hitting the floor. And I'll leave out the air water syringe and the handpiece hose with the black on it.
Okay, and then she will obtain the blue tape to barrier the light switch, the view box switch, the operator chair adjustment controls, and then on her cart, she will barrier okay, and on her cart, she will barrier one set of pins.
A great helpful hint for you guys is to fold one side, roll your pen up so that when you go to take it off, it's much easier and it's not sticking to itself.
Okay, and then she will barrier the light handles.
Another helpful hint is whenever we bury this, we only bury the face, not this side or on top at all, just the face of it. This light heats up and will melt the plastic, so only across the face.
Good, and then the ultrasonic will barrier that as well.
Give yourself a Mester and wrap to completely cover what the ultrasonic is sitting on, and all of your cords.
Okay, and then we will grab barriers for the high volume evacuator, the saliva ejector tubing holder, the ultrasonic, and the air water syringe handles. Okay, then she will identify half of her rolling cart as clean, which is always the drawer side.
This will be my clean side.
And one half of the rolling cart as contaminated, which is always the back side, by placing that blue barrier there.
I will also designate on my treatment record prototype my dirty side, so I can use my clean side to help carry my chart.
Okay. And then she will obtain disposable intraoral supplies and patient glasses and place them on the barriered bracket tray. And then another helpful hint on this part, you're going to actually have to set up your suctions because you're going to need them later on in your PE.
When you put your high volume evacuation on, you always want the hole facing up and not down into the tube. There's a spot without perforations, and you're just going to go right into that.
And then following the check, CI check of the sterile packet, so we can see right here that that's sterile. She will open the instrument packet onto the bracket tray by sliding the instruments onto the bracket tray without hand to instrument contact and without touching the outside of that wrapper to the bracket tray. And then she will obtain a cup and the appropriate amount of antimicrobial mouth rinse for an adult patient. And she will place that on the bracket tray and then cover it with the patient napkin and bib clip until the patient is seated. Okay, she will place the patient napkin on the patient, and then you will instruct all adult patients to rinse with the antimicrobial rinse for 30 seconds prior to intraoral procedures, and then
spit it back into the cup when you're done rinsing.
And then while the patient is swishing, she will put on her mask, her protective eyewear. She will wash her hands or use sanitizer and then put on treatment gloves. Once she is all gloved up, she can touch her instruments, so she will set them up, including arranging the air water syringe. And then she will suction the antimicrobial rinse with the saliva ejector. and then return the cup to the tray to use for discarding debris during the appointment. She will provide the patient with protective eyewear. Patient PPE should never leave the operatory. And then she will utilize the barrier technique for recording entries during intraoral procedures. She will avoid direct gloved hand contact with contaminated surfaces, especially but not limited to mask, eyewear, including loops and light, her hair, and the patient record. She will keep instruments clear of gross debris. She will keep a neat and tidy tray throughout the appointment. She will wipe the mirror face clean with a damp 2x2 gauze. Then she will always remove and discard gloves and wash hands or use sanitizer when accessing supplies in the drawers or cupboards, or when she's leaving the dental operatory, or after performing intraoral procedures and or handling the patient's permanent charge. She will always rewash hands or use hand sanitizer and re-glove when returning to the operatory if intraoral procedures are to be continued. She will pick up any dropped instruments with gloved hands and place them in the red contaminated bin in the team area. Then she will deglove, wash hands or use hand sanitizing rub, and then she would re-glove when she returns to the treatment area. So everything you saw done today was narrated, but when you do your PE, you will be responsible for verbalizing each of these as you perform the actions that she showed.